So hi everyone, I am Amy Klein and I'm the head of competency-based education for Laerdal Medical, and we are just so excited for today's panel webinar. I'll introduce our esteemed panelists here in just a moment today, but we are going to chat with them about how simulation fits into that larger picture of competency-based education, share a few ways to integrate simulation at the program level, and then also analyze the challenges and opportunities of using simulation for competency-based assessments. You can feel free to use the Q&A box for any questions that you might have. You can also use the chat, but occasionally we lose track of the questions in the chat. So if you want to be sure your question's answered, pop them into that Q&A box that we have as well. And that way we won't miss them. What we'll do is go ahead and let our panelists introduce themselves a bit. And maybe we will start, sorry, I can't quite see my screen. I'm not sure why, but we'll start with Curtis Nicol, please.
Yeah, no problem. Hi, my name is Curtis. I'm an anesthesiologist at the University of Ottawa and the Ottawa Hospital. I've been involved in simulation as a simulation educator for probably about the last 5 to 7 years. And probably more particularly relevant to these conversations that we're having is I've been involved in the conversion of the Canadian programs and our residency program in particular to competency-based education since about 2017. So I've been the curriculum director for our competency-based education program, as well as one of the main sim educators who leads the competency-based side of things for us. Happy to chat about this, something I talk about not infrequently and love to talk about. So the toughest part will be keeping it to 60 minutes.
Great. All right, Marie.
Yeah, good morning, good afternoon, everyone. My name's Marie Gilbert. I'm the director at the Central California Center for Excellence in Nursing out of California State University, Fresno. And the purpose of the center really is to advance nursing education and clinical practice. So competency-based education really fits into my role, as well as simulation. And I'm really the newbie to CBE on the panel. Curtis and Brian have a lot of experience with implementing it. I, like many nurses, are still in that exploratory phase, so I'm happy to share what I have learned so far.
Thanks, Marie. And Brian, I'll have you go.
I'm Brian Mann. I'm the Chief of Simulation Operations for Philadelphia College of Osteopathic Medicine and the Interim Dean for the School of Health Professions and Sciences. I'm located on the Georgia campus in Atlanta. However, I cover 3 simulation centers throughout the United States and all programs that we offer simulation services for. Anything that I say here today on this panel will be those of my own views and not the views of PCOM or any of its affiliates. So I look forward to this awesome conversation that the 3 of us have been able to have throughout the last several months and at the last year.
Great, thank you. And it's really exciting to have all 3 of you guys because we know that you are part of the leadership of the Society for Simulation in Healthcare's Simulation Grounded Competency-Based Education Task Force and Affinity Group. And I wonder, Marie, if you could maybe tell us a little bit about that group and what you're hoping to achieve by having established this group.
Absolutely. So the task force, the Simulation Grounded CBE task force, came together last year, and it consists of myself, Curtis, and Brian, and there are 3 other members, and I want to give a shout out to them. So Kristen Brown. Kristen is the Associate Dean for Simulation and Immersive Learning and Associate Professor at Johns Hopkins University School of Nursing. Vivian Obeso, who she has many roles. I'll identified 2. She's Associate Professor and also the Senior Director for Clinical Skills and Competency Assessment at the University of Miami, Miller School of Medicine and Gordon Center. And Madeline Keener, who is a research consultant, and she has expertise in cognitive psychology as well as learning and assessment science at Brighton Research. So the 6 of us come with a very diverse background. The task force really started, it was clear to SSH, Society for Simulation in Healthcare, that there was increasing numbers of CBE presentations at IMSH. There was increasing numbers of discussions on the SimConnect listserv about what is everyone doing. And that many educators and administrators, this isn't just educators that are are seeking guidance, but many educators and administrators are being asked or directed to increase the amount of simulation they do to support CBE, and that many of us were looking for right tools and guidance. So the overarching purpose of the task force is to create and disseminate a simulation CBE model that is a flexible and practical framework to into how simulation and CBE integrate that could be adapted and used in a wide variety of educational and practice settings. So just an update on our work so far, we had two initial goals. The first goal, led by Kristen, is to start and complete a scoping review and also initiate the affinity group. I smile because the scoping review is proving to be huge. So we have started. We had a long way from finishing yet, but we have started the scoping review, and we're looking really at the current state. So we're looking at how simulation is being used to implement and support CBE with secondary questions around outcomes, benefits, and challenges. And then the Affinity group, which was launched in September, Curtis and I chair that group. And our hope is really to build this interprofessional, interdisciplinary community where we can connect and share and develop best practices. And Curtis, I don't know if you wanted to add a little bit more about the Affinity group. Just one more thing to say about the Affinity group. One of the reasons we're really excited about it being an Affinity group is if you are not an SSH member, you can still join the Affinity group. You can set up a member login without actually being a member. So Curtis, did you want to add a little bit more about the Affinity group?
Yeah, absolutely. I'm happy to. I think the Affinity group is really our bridge and our connection to the community of educators and practitioners who are sort of working through this process. It's very flexible in terms of we usually have about a scheduled session a month on a variety of different topics. But then you can take it from there in any way you want. So we're going to just start developing some working groups and that sort of thing where people can kind of move forward within their own interested area, whether that's, trying to implement CBE at a program level, whether it's assessment-based stuff or anything along those lines. And so I have found it exceptionally useful, even as someone who's been involved in CBE for a long time, just to hear what other people are doing, and in a broader captured way than when you just kind of go to a conference and you get 60 minutes to talk to somebody. It really allows you to make some connections and have some conversations, and learn from different specialties and different professions and disciplines and groups that I didn't even know did CBE. So I would encourage everybody to join. I think it would be really, I personally would love it, if only if I get more information and learn more about it. But hopefully we can actually provide you some benefit as well. We have, I'm not sure when our next meeting is, but we got one a month, and then we're going to start developing some working groups here going forward.
That's so great. And I think it's wonderful that SSIH, recognized this rise in requests for sessions and content around CBE, because it certainly has been for the past, almost 3 years now, I would say, kind of present everywhere. But if you could just share about what the rise in CBE could be attributed to, and where you kind of think that people are in the adoption process of CBE on a global scale, perhaps US, North America, global as well.
So I'll make a start with just, and again, I'm going to focus just a little bit on nursing. And I think the surge is noticeable now, but I think it's been coming for a while. So maybe we're kind of in the tsunami stage of it. I think it has actually been coming for a while. And if you think back in nursing, particularly around 15 years ago, Patricia Benner's report about nursing needing radical transformation. And I think that really laid the groundwork. So for my non-nursing colleagues on the call, Dr. Benner highlighted a disconnect between what students are learning in the classroom and what they actually need to be able to do when they're in clinical practice. And I think that's probably similar for other professions, but I don't want to talk out of turn. And if we think about nursing programs currently, they're very often very content heavy. They rely on assessing and testing what the students know. And when you're doing that, you're testing memorization. So while students may be successful in the class, they may be getting A's, they may be passing the NCLEX, which is our licensure. When they come to clinical practice, they're not able to apply that knowledge in a real clinical situation. So that's where the concerns about workforce readiness. And I think on the poll, that was one of the top answers, that CBE will better prepare the workforce. So I think that's the drive. What's really pushing it for nursing is organizations like the AACN and CCNE are now requiring it as part of accreditation. So that's where I think the tsunami's just hit, but it's been coming for a long time. It's a good, sound teaching and learning strategy. So and hand over to my colleagues for.
Marie, thanks for that. I think you're right on. I think it's coming. It's been coming. We see it in the United States medical school education side of things, where ACGME and the residencies have moved to milestones years ago using the EPAs, entrustable professional activities. And now that's going to be dribbling down into the undergraduate level, where the AAMC and AACOM have come together with ACGME to create their competency-based education recommendations that were published in December of this past year. But other programs and other professions have also had some level of CBE that is starting to come out. But I would have to say that I think we're in an interesting position right now, because I think it's time that technology has actually caught up with us, or we've had it catch up with us to make this process actually something that's achievable. And I'll talk about that a little bit later, but technology, we needed this technology change with generative AI and quantum computing, if you would, to kind of help us through this, to get a better picture of the health of a student, if you would, overall. And that health of that student, grades or whatever it might be that we look at, should go from undergraduate all the way through into their professional development and professional life. And I think we're kind of at that crux right now, where we can do this because we have some technology to help us. So we'll get a little more into that in a few questions.
Thanks for that. I think you're right, though. We are at this place now where not only have we recognized this gap that exists in the transition to practice, like you said, Marie, but also we're at a place where we have more data available to us in real time on how students are performing or what they're knowing and understanding, and how do we shift that into closing that gap. And then, like you said, Brian, bringing that through into their actual practicing profession as well, because it doesn't end when they get to entry to practice, right? It only advances and continues. And so, I wonder if you guys could share a little bit about what ways do you think that simulation really enhances the effectiveness of CBE, or, sorry for a double question, that's a poor simulation facilitator technique, but how can competencies, really be most accurately assessed when it comes to using simulation for assessment of those competencies? I think that's kind of a burning area, it seems to be.
Yeah, I'm happy to just try to answer this one. I think this is an area that we've been involved in Canada now for a little while. I'm going to start off in that the terminology around competency-based education seems to vary everywhere we go, and so I'm going to use some terms. And if there's any confusion, please throw it in the chat, and I'll try to be clear and use more general terms. Because when I use milestones, it's different than when Brian uses milestones, referring to the American system and that sort of thing. But really, I think the key crux of this is that this simulation fits really well into competency-based education, and is a great tool within the tool belt of providing an education through competency-based education. I think one of the major sort of confusing factors for people who aren't familiar with competency-based education and simulation-based education is that they sort of see them as the same, whereas really competency-based education is this like overarching concept in this blueprint that simulation-based education fits beautifully into. And the reason it fits beautifully into it is really that a lot of the main pillars, those thought processes, those key concepts around competency-based education are also the same key pillars of simulation-based education. So, learner-focused, having clearly defined outcomes that you're hoping for out of your teaching methodology, whether it's an assessment or a teaching methodology. really you're just changing that from what we've previously called an outcome into making sure that that's actually labeled as a competency, and make sure that it's truly a competency. But it's still a very similar concept. The fact that we can scale things, we can be flexible towards the learner, we can make it easier or harder depending on what they need to do, and we can adapt it to where the learner is. And that's really the key thing, I think, both about simulation and competency-based education, is we're moving away from a concept around the system and teaching through the system, saying, you have 4 years, you have 1 year, you have 2 years, and hopefully you get it within this time period. And if you don't, we're out. That's too bad. That's where we're at. To being like, you know what, this is about you now and your individual learning pathway, and how do we get you from this starting point all the way to this finishing point, and not everybody's going to take the same pathway. And so I think that really allows us to do things within simulation that we've already been doing that fit really beautifully into competency-based education, just a bit of a change in mindset. And so that's why I think it really enhances it. I also think it provides opportunities that we just don't otherwise get in clinical practice or in our teaching world. Those high acuity, low occurrence scenarios for us are a major thing in anesthesia. My residents, no matter what, in 5 years may never experience that, but I can get them to experience running it entirely on their own in a simulation. And that's a key thing that they have to know. Being able to move from that sort of, as Marie was saying earlier, that thought process of, do I know what this is? There's a big difference between knowing and doing, and simulation moves that bar. No longer do you just have to know the material and be able to fill out a multiple choice exam. But you actually have to be able to do it and show it. And that really helps, I think, get a better idea of where these trainees, no matter what profession they are in. And I think that's why I think it enhances things heavily. I'll let Marie sort of jump in a little bit about accuracy and sort of simulation and competencies and how they can be assessed, and I'm happy to talk about that as well.
Thanks, Curtis. And I agree completely around the key pillars. I think that might be why a lot of simulation educators, it's like, well, yeah, this is good educational strategy. This isn't something new. And in addition, to kind of build on what Curtis says, when we're talking about competency development, we don't want to shift just from kind of this heavily academic of assessing what their knowledge is to just assessing what they do. What simulation does, it allows us to actually have the student reflect on what they're doing. So this kind of rounds it out, in that a student could do something right for the wrong reasons. And with reflection, you can identify that. It's happened to me many times where you think, wow, that was brilliant. And then when you're in the debrief and you're uncovering their thinking, they're honest and say, oh, I don't know, I just saw that in practice and thought that's what you do. So it really does encompass the whole picture of competency. So you really are assessing, do they have that knowledge, appropriate knowledge that they're applying to practice, and vice versa. Sometimes they do the wrong thing, but during reflection, their actual rationale, their critical thinking is sound. So they just made somewhere an error in judgment. So I think this really allows us in simulation to dive into that thinking component. Because again, the risk, the fear that I have is, because we talk a lot about what can they do, we're going to not get rid of just the checklist and one and done. Yes, it is important we assess in what we're doing, but don't lose sight that we're really looking at their knowledge application in practice. Again, which is why I think simulation makes it so effective. Now, that's not to say in other areas of education, you should be doing that in theory. You should be doing guided reflection on responses in clinical practice, in post-clinical. So I think we can take a lot of skills that simulation educators have and translate that into all areas of the curriculum. So I don't know if I answered your question, but I'm passionate about this, so I hope I did.
Oh, I think it's great. It is good. They do simulation and CBE do fit so well because they do share those common tenets of educational practice, which I think is nice. And, the one piece that I might just pick on Brian a little bit because I know he has some thoughts about this, but, we're hearing a lot about we're going to shift from using simulation where it was just formative, no assessments, maybe not even checklists of how people performed, but just the discussion and the debrief, which is beautiful and provides great insights to now we're hearing programs saying, well, every course is going to have a summative simulation. And if you can't pass that, then that's how we know that you're not competent. And so, Brian, I wonder if I could ask you just to kind of talk about the balance of, how do we think about summative assessments in relation to simulation and how could we maybe rethink that in our minds a bit
Yeah.
or balance it?
Yeah, thank you, Amy. We have had this question, I would say, this has been one of the burning questions for everybody in almost everything we do when we talk as a group, actually as a task force, and anything we present on. So I appreciate it. I think the word summative has to be first, we need to define it. I think the way we've defined it in the past has been exactly what you said. And what Maria had said, it's, this one time and done idea. Summative in general, and this is my own definition of it, is summation of information. And the basis for that competency-based education is summation of multimodal assessment over time. How much time? I don't know. And a lot of us don't know because it really has, in a lot of ways, it has a bit of an apprenticeship model, if you would think of it that way. But summation is the whole picture. And it doesn't necessarily mean 100%. That's the other thing we have to get away from. That's why when Curtis had said something different about, the American side of milestones versus what they do in Canada, there is a difference between us when it comes to that. So I think we need to define it better. And I think it's hard, and I know we've noticed this with the task force groups we've met with, to get those older ways of thinking out of our head. And what I would say is just, again, Curtis talked about opportunity, Marie talked about opportunity. Maybe you use simulation to help teach a class, actually in the actual class, and assess how your students are doing in small groups. Maybe it changes your PBL a little bit, or TBL, whatever you want to call, whichever method you're using. Maybe it changes your lectures. I don't know, but it's just remember, none of this is one and done. This is, we have to stop that thinking, but we still have to put all the pieces together. And by the way, some of that might actually include multiple choice test questions. So the whole picture is summation. That's how I look at it.
I really appreciate that definition, and I'm glad you were able to share it because I think it is, it's not getting rid of everything we've ever done and only doing, experiential or simulation-based learning. It's finding the balance and how those pieces fit together, which, is somewhere I know you all have started to look into. Or, this is a lot of information, a lot of student performance when you're talking about competency-based assessment. So what kind of tools and solutions are there that are out there to help people as they navigate this breadth of performance assessment, and where do you see the gaps currently? Guessing I might make one of you take it. I think maybe Brian, did you want to go first, or Curtis? I wasn't sure.
I'm happy for Brian to go, and then I'll supplement whatever he says. He's a very smart man.
So I think here's where technology comes into play. Because I just spoke about the idea of multimodal assessment, you have to think about how you're gathering data on your students or with your students. And then not just gathering data, but how it's actually going to be used for their success. We don't need to go too much into the generational differences, but the current student learner out there wants data back and feedback much quicker than most of us can actually review something and give it. So again, start thinking about how you can use different products out there with artificial intelligence to help you make that happen a little quicker for their success. But you have to think about how all of the components to a student's grade, if you would, is actually brought together. So I can think of not only are there programs out there to collect, to do exams and then collect the scores on your exams. But then there's also programs, similar to Sim Capture here, that collect data and have the ability to, with a good rubric, be graded and actually collect data on the humanistic and biomedical side. How does that information come together? On a task training side, how does that information come together? Maybe it's as simple as using something like a Google Docs or a Word or something like that. I don't know, but or even, I hate to say it, some people might have to use the hand circling idea, but with AI now, you can use OCR and actually gather that data. So there are ways to gather data, and I think that's the important part. Where the gaps lie, I think, is not. I don't know that we know where all the gaps lie yet, because we actually have to start doing this, and that's the exciting part about me, is I get a chance to actually start putting these in place with gathering data, creating with our team a data lake and then a data warehouse, and then hopefully get an individual learning plan out to students over time. That's where I'm at right now. So I hope that helps. I know it's a lot of technical terms, but I think hopefully it helps you with some ideas.
Yeah, I completely agree. I think now in competency-based education, the concept of obtaining data and what is good data versus what is useless data, and then what do we do with that data after? So I think it's like a big time for data analytics, a great opportunity to use data capture and data analytics to really understand your learner, but not just your learner, your whole curriculum, your simulations, your teachers, everybody. And when I go to some of the conferences that I attend, that's really what a lot of it is about now. And I also agree, we don't know where all the gaps are now. Even in Canada, we've been doing this for quite a time now. We're on to our second or third edition of our EPAs for my specialty, which is how we operationalize competency-based education within our program. They're having major task force meetings now on how to implement competency-based education as a whole. So we're on to what we call CBD 2.0 coming up. Because you find gaps by doing it, things that you didn't know before. All of a sudden you'll look and you'll go, "Oh, we're not assessing that in any real way," or "I have no idea what this data means. Oh wow, this is actually really important, and I'm not really sure what to do with it. How can we do that?" And I think one of the other key things, and it's interesting because we're obviously here with Laerdal, but I think pushing your industry and pushing these groups, these companies like Laerdal to help us with that is key, because it's going to be difficult to do that on your own. I know groups who've tried to do it on their own, and they're doing it by hand. They're doing it on an Excel spreadsheet, and it's difficult. It's really, really hard. And if we can optimize that through industry help, I think that's a great opportunity as well. So I think I agree. I think the data capture side of things, and then what to do with that data, is where we're going next. And it's going to be different for every program, every specialty, every discipline, and you just have to we're gonna have to work through it. You're not gonna be perfect off the bat. Remember that. You're not gonna be perfect off the bat. We still aren't, and we've been doing it for a long time. But you'll figure it out as you go.
I wonder if I could just clarify something you said too, Curtis. You talked about useful data and maybe less useful data when it comes to student performance. And so, what comes to mind for me is that, the different levels of the Kirkpatrick's a little bit, is it just the reflection of learning? Is it actual learning taking place? So I wonder if you could just clarify what you mean by, what would be considered more useful data when it comes to assessing student performance, maybe specifically in SIM, because I'm sure that's quite the breadth as well.
Yeah, absolutely. I think it's broad. I think it's a very broad area. I like to, whenever I look at the research projects out there or data that we're doing now, I agree. I kind of look at the Kirkpatrick model and try to move upwards in it. I think there's a really good, it's easy to get satisfaction. Did the learner enjoy the activity, that sort of thing? And I think that's an important data, right? Because it helps us get a better idea of whether they're going to be engaged in said activities and that sort of thing. But in the end, we really want this to be linked to the competencies that we've developed and created. And if we're not measuring things that directly link to those competencies, and those competencies should relate to exactly what someone is doing within their job, what should be related to their career, the actual essential activities, the things that the outcomes that they need. Those are the key elements. So things that can be patient related, that are actually going to have true patient related outcomes. That's the high level of Kirkpatrick. That's the high level of data that you really want. Now, there's obviously going to be stepping stones to get there, right? We're not necessarily going to be able to jump right from this all the way to, patient influencing or patient based outcomes. And so you may need some of those smaller outcomes that are in there. And that's one of the great reasons the simulation works so well, is that you can sort of start to target those. Then as you scaffold and as you progress, I can take a junior learner where really all I want them to be able to do is talk to a patient and have a conversation with them. And I'm going to be able to assess them based on their, a rubric or something, based on their taking a history and a physical. But then down the road, I can actually say, okay, now you've done all that, but now I need you to be able to take this and implement it in a simulation where that information that you gathered is actually critically important to you managing this patient or alerting the physicians or whatever the case is. So moving from that sort of satisfaction side of things in and beyond that in towards those patient-related outcomes and things that really directly to the competencies. That's the good data. That's the data that's going to be really important. And when we moved forward, we realized we were gathering a lot of data that probably wasn't that important, didn't really relate to things. And one of the big issues that we had when we first implemented competency-based education was learner burnout and faculty burnout, particularly around assessment. And so if you can downsize some of your assessments because you recognize that actually the data that it's gathering is not that helpful, people love that. The less things they have to fill out, the better. So if you can have meaningful, you want all your data pieces to be meaningful.
Yeah, I think that's really nice. And something you just said really resonates of, learner burnout. If we can't make them do something every day and make educators fill something out every hour of how are you performing in this hour and the next hour, right? And so it kind of brings to mind, I think a little bit of the healthcare standards of best practice in how do we construct or evaluate simulations that are effective to meet competency. So I wonder if there's anything you guys could share as far as, when you're making a simulation for competency development or for measuring competency, what are some factors to consider so that you don't have to, do 6 different simulations that are mini and focused too small, but then how do you also make sure it's not too large of a sim and covering, the whole waterfront, as they say?
I think for me, it's always been, and luckily I've had this mindset for a while, is that it's broad. So if I'm looking at diagnostic studies for a medical student, that not only do they need to interpret. So that's part of the simulation. So I look at all the key components that need to be part of the simulation, and we make sure they're part of them, but keeping those goals a little bit broad. Now, on the assessment component of that, though, and I don't want to discount this component that sometimes people discount, is that qualitative assessment. Because as Curtis said, there's these ideas of these stepping blocks. But as we all know, even as we progress through our own careers, sometimes we'll have some ups and we'll have some downs. I often like to say that, like if every pitcher in baseball was out throwing a no-hitter every day, the game would probably be relatively boring. But that's not what happens, right? And we actually, they achieve greatness when they're only hitting 30% of the time, 300, batting average of 300. So here we have the same thing. It's a developmental thing, right? So in those simulations, I would just be cautious of, knowing where they are developmentally, know who your audience is. And again, I think these are all the best practices anyhow. I mean, repeating them, I think, is always a good thing. Know your objectives. What's the objective? And then go to the assessment. The component of it, that the components come together, but be careful to hold yourself to being too narrow. I think that's what I find too often is people are too narrow, and then that affects the simulation in general. So remember that if we keep the mindset of this is a small portion over time, guess what? If we don't hit it this one, we'll get it on another one.
That's great. Thank you for sharing that. And I might call on each of you in this question I have here of, could you maybe describe how simulation is incorporated into your curriculum, how you align it with your educational objectives, and then how do you effectively support students as they are developing those competencies. So, maybe just giving an example of one course or one concept or competency that you're teaching, and how did you effectively integrate simulation to support that student development, and what's the role of the educator in that as well? The million-dollar question, perhaps.
Yeah, I'm going to go first because I'll have the shortest answer. Because we are still in the mapping stage. So, I look back to even before this competency-based education was even beginning to bubble, and curriculum mapping has exploded. The tsunamis brought this, but that is something we did way back when. So we would be integrating our simulation into the curriculum map based on the course outcomes and the program outcomes. But we're still mapping, so I don't have an exact example I can give you, but I'm going to hand over to Curtis and Brian that I think may do.
I feel like that is a good example, though, of at least knowing where is your end and starting there first, because you're not going to create simulations if you're not sure on the outcome, right? So, sorry, go ahead, Curtis or Brian.
Yeah, I'll give you sort of two examples that are sort of unique. Well, one is not unique, and one is probably what we should all be doing. And we were lucky in that we had a key group of educators who were interested. So when we first converted over to competency-based education, all of our simulation educators reached out to our residency program leads in order to facilitate and have a discussion around what we could do for them. So, how do we integrate simulation? What kind of key pieces of either assessment or teaching can we be involved in, and at what stages? And so we did exactly what Marie's talking about. We went through curriculum maps, and I have maps upon maps upon maps at my computer that talk about all the various different ways that we've implemented simulation throughout. And so ours are tied specifically to certain competencies within our and EPAs within our sort of our competency-based education framework. And that's how we've integrated those throughout what is a 5-year residency program. So for us, we have a long time with our residents compared to a lot of programs, which allows us to have a greater exposure over time and not having to worry as much about trying to narrow things down in a really tight way, which just is a different sort of challenge. You can still do it. It's just a different challenge. And then our program is a unique program in medical training, I'm going to say, in North America, in that we have a national simulation-based exam that we developed about 5 years ago and have been implemented. Well, actually, we developed about 8 years, have been implemented for about 6 years. And it consists of high acuity, low occurrence scenarios, and they do it in their 4th of their 5th years. And we developed that through a large Delphi across all of our educators and our Royal College, which is our sort of accrediting body. And so every trainee has to pass this exam. And in terms of those sort of concepts that we were talking about before, of like, what do you need to be effective and have effective simulation? I think if you're having a major summative evaluation, which again is still one piece of the picture, as Brian said earlier, it's one part of it. It's not the end all be all. It's just one piece. It's an important piece, but it's one piece. Is you need a lot more rigor, a lot more validity around your simulation. You're going to take all those best practices of regular simulation. You're going to add all the best practices of assessment and put it all together. So that becomes really a lot of work. And I'm the vice chair of that group, and we put a lot of work in every year. But that's 2 ways that we've integrated simulation within our curriculum. One, on an ongoing basis, both as a formative as well as more sort of teaching with some assessment in there, and then one is a major sort of summative. I'm gonna say quotation summative. I like to talk about stakes rather than summatives because I agree with Brian. I think all the different pieces come together. So a more moderate to high stakes exam.
I think I'm going to give you an example of before we formally called it CBE, we called this almost a hybrid curriculum, if you would, from another institution I was at, because we have implemented some of those things here, but it was much more advanced at the other facility, at the other institution. For those of you that are on the call that have to ever make a argument for why you use simulation or a return on investment, or why you're buying a very expensive mannequin, if you would, the best thing you can do is actually incorporate it into curriculum, and then it's forced to be used, as opposed to it being something that's extracurricular, which has its own merit, but So I was in a position where it was great because I got the right curriculum for very expensive equipment to be actually used in the curriculum. So it worked out quite well. So the idea behind the hybrid level of the curriculum, at least in the undergraduate medical school side of things, was, in our first year with first-year medical students, they would come in to the sim center. And I would like to classify simulation just as not as high fidelity. Simulation also for us includes standardized patients and OSCEs. It includes everything. We don't separate SP versus simulation. So they would come in and they would have an experience the first day of class, just learning how to shake a hand, introducing themselves and sitting down. Sounds so developmentally silly, but it actually is what's expected of the program over time. So over 2 years of doing that every day, even when they're in simulation, working with a high fidelity mannequin, guess what? The same thing, the same behaviors are happening in a very small way. But then it goes outside of simulation. Then we would take the same topics we're using in simulation, or maybe the topics that are actually we're using in their coursework, and we bring those alive in simulation experiential learning, whether with the standardized patients or the high fidelity mannequins. But it didn't stop there. Then we have small little case studies every week where they'd practice oral report, and they would actually work through their critical thinking, relating back to those topics that we did in the classroom or in simulation. So it all is connected, fully connected. And I think that's the only way really to get it, because then when they go out to clinical rotations, we take it in their third and fourth year. Now they're doing it in real life. But the nice part about there was they were brought back at the end of every month for a test, and then they worked in simulation preparing for the next site. So we're able to see their training, their results, what they ended up, how they were progressing. I hate to call it longitudinally because I don't know the longitudinally anymore. I think people development is both vertical and horizontal at the same time, it looks like. But that's some of the ways we did it. So we called it hybrid, but ultimately we had a complete picture of how they were doing in the classroom, in experiential learning, on clerkship, and then on their boards. So that was the full picture we could see on everybody. And at that time, we still had the level 2 CE or PE or CS or PE, depending on what school you're at, prior to COVID, of course, when that was halted. So it's a really neat way to be able to assess, where you are with your students. And they went out and they shined on rotations, and that's and patient care, and they're all attending physicians now doing extremely well. So that's pretty cool to watch that when it's integrated like that.
Yeah. And there's 2 questions in the chat that I think might relate to what you were talking about, Brian. It might have been the question prior as well. But it's just clarifying, too narrow is the question, as if is the simulation assessment too narrow, or what we're expecting out of students too narrow, and maybe just differentiating what you meant there.
Yes, and please, Curtis or Marie, chime in here on your side too.
Sorry, I keep putting you in the hot spot.
Yeah, no, that's okay. But sometimes, and I just don't want to speak just for myself on this, because I guess it goes back to actually asking the question, if someone's requesting your sim center or something for assessment, make sure they write objectives down in your request, because and you have a discussion with them, because sometimes you find out that you get a simulation request that they want to just assess an IV, starting an IV. Well, that's nice. Is that the right thing? Or should that just be done on a task trainer? So, I think that's the idea of, if you're using the scope it's the scope of what you're trying to do. Is it too narrow to assess that is a task training more appropriate than the simulation? Or I'll give you another one is, sometimes, OB, especially OB, sometimes hard to come by. People request an OB experience. That's an experience. That's different than doing every single person delivering a baby.
Right.
Those 2 things are very, very different. It requires different stuff. So that when I'm saying too narrow, I'm saying too narrow of the task that you're trying to achieve for the assessment. Now, I'm not saying it's not important. You might want to, maybe that is your case. Maybe you want them to actually talk to the patient, assess the patient, see if they actually need IV, put the IV in. I get that. If that's the case, if that's the true case behind it, then make sure you're assessing all the other things that go along with that, not just starting the IV.
Yeah, I think that helps a lot. Go ahead, Curtis.
Yeah, and I would also say, like, in terms of narrowness, and I think this sort of speaks a little bit to what Brian was saying before, is that remember again that CBE is, even if you're just running a course, like a 1 month course, competency-based education is not made up of one assessment period one time, right? So maybe they just had a bad day. Maybe they get a 3 out of 5 that day, but they get a like 3 5 out of 5s later on. So don't narrow your focus so much that if they don't pass this one assessment, that they're not going to be successful going forward, unless that is truly what you're looking for out of that assessment. And so having that sort of broader picture within your curriculum of where this fits in is always helpful. And if they aren't successful, how do we develop a learning plan for them? How do we remediate them, if we're going to use the remediation term, going forward that way? So be cautious be narrow in terms of your having specific objectives and making sure that there's functional task alignment with your sims, but be broad in your overall picture of where this fits into your curriculum.
And I'm going to just build on that. It's not really to do with a narrow, but it's just to jump off something both Brian and Curtis have said, that when we're thinking about competency-based education and the assessment that's built into that, it is a different mindset for faculty and for students. And I don't think we've really dove into it today, but thinking about that growth mindset, that is something that is going to be very different for students. And I kind of mentioned it earlier, students have gone through that academic career where the measure of success is getting something right. And that doesn't lead to this growth mindset, which is really, obviously you need to gain the knowledge and the skills, but you also need to gain that growth mindset of, okay, I can't do it yet, but what do I need to do to grow? And that really is the essence of competency-based education. For me, that's kind of my takeaway. And any of you that haven't yet read Carol Dweck, thank you, Growth Mindset and Her Power of Not Yet. When I came across that, I'm like, this is our shift, and our students need to know that. I know at the beginning, the poll was no issues with students. That might have been because there were multiple choices and you had to pick the highest one. Students are going to, I think, have trouble with this because they're not used to it being okay that a mistake is actually a way of learning and growing. So, and again, Curtis, we've kind of gone off at tangent a little bit here, sorry. But Curtis and Brian, I don't know from your experience, if you can build on that.
Yeah, I agree. I think you really have to move into this growth mindset of failure is a tool to become successful down the road. And so I think simulation fits into that beautifully, in order to provide those opportunities both for people who are advanced or who are behind the potential learning curve and breaking things down and allowing them to move forward. And I think that's like an incredibly important piece of thought process that learners and faculty, to be quite honest, struggle with.
Very well said. And I do want to make sure we have some time. I know there's a lot of questions in the chat and the Q&A. And so I do want to just make sure we get to a few of them. We will share the resources that Laerdal has about CBE in just a moment. And then to join the SSIH Affinity group, I believe we put the link in the chat, and we can maybe place it again, just so that everyone can get there a bit faster. And then, Marie, I'm not sure if you'd be able to place the name of that book and author in the chat. That would be super helpful. A lot of people asking for that. And then this question was really nice. And I know all of you work in academia, but curious about, outside of academia and educational institutions, are you seeing hospital systems also moving towards simulations during their, competency days or education training? Are you having any of these conversations with your practice partners?
So we get
requested all. Sorry, go ahead, Brian.
Yeah, we get requested. We do get requests, and we actually have contracts for different hospital systems, specifically for new residency programs or whatnot. And then now the talks start to evolve into, okay, can this work for our attending faculty and staff? Even though it's not truly, you know, they may not be academic. They see the educators are seeing the value of it at the hospital system level.
Yeah. Curtis?
Yeah, we're doing the same. Obviously, I'm at an educational institution, but we provide services to a number of non-educationally aligned or non-educational institutions per se, in the same concept. I think simulation is recognized as an excellent way for, especially in situ simulation, for different groups. And so we've been doing this for a period of time now. And we offer offsite, in situ and non-in situ simulation for a variety of places. I think you're going to see it more and more as people, it's harder to know everything now. Like there's so much to know. There's so much to know. It doesn't matter what profession you're in, there's so much to know, and to be good at, and your exposure gets limited. And I think simulation provides that opportunity.
Yes, I think so. I think that's a great answer. And we definitely are seeing it more as well with, you know, the customers that we interact with and our partners that we interact with at Laerdal. You know, how do we continue to advance competence in nurses and physicians and different providers, because they may enter, you know, in one specialty and want to switch to another, or like you said, Curtis, things are always evolving. So how do we continue to not just teach this is the new way to do it, but also see that they can apply and demonstrate it in situ? There was another great question. I know we're getting really close on time, but I do want to make sure we address this. It says, can you address the faculty and the simulation staff resources necessary to implement CBE? It's a big question.
Yeah, I think I'll take a quick stab at it. I think it all depends on what you're trying to do. You can run a major program, you can run a major course. I know Brian, at a talk that we did not long ago, gave a great example of, you know, providing some CBE type education to like a mass of like 300 or 400 people, and that requires a lot of people to do that. I don't think anyone's gonna pretend that that's the case. It's not the case, but I think you can also do it on a small scale, and sort of as Brian was saying before, having that task alignment and that alignment between your objectives and what your educational strategy is allows you to fine tune that resource requirement. There's a great example in the world of urology and in medicine where, you know, you could have this like super fancy $20,000 task trainer to teach your uroscopy, or you could have a cup with 2 straws. And the evidence shows that the cup with 2 straws is as good or better. So you don't necessarily have to do it. And I think a lot of times groups, including myself when I first started, you only translate it into super high fidelity, you know, fancy theater-based sim. And while that has a great role in it, and the educators that are part of that have a great role in it, it's not necessarily everything. So making sure that your objectives match, and then moving things around allows you to sort of help address that faculty and simulation resource issue.
Yeah, sometimes it's a reallocation as you start to map and identify, we could shift this out of didactic and into sim, or shift this sim into didactic. And so getting creative, I think, is a good strategy as well. It certainly still takes investment, though. I know it's not just what you have now can rework, but it's thinking really smartly about how do you realign and then where are your gaps. There was one question that I know was asked twice, so I just want to make sure. Can you speak to the regulatory requirements for student privacy and record retention aspect of summative assessments when using AV? I'm guessing it's Brian, you might have the best.
Yes, I can actually. I think the best course of action is to actually refer you back to your records and retention AV policy at your university, because I have found that each of them has been very, very different. And I think sometimes the lawyers that represent you they interpret it all just a little bit differently. But know that there have been plenty of schools out there that keep records on a cloud-based secured system, like those that are available to us at this point in time. Everything from task training to simulations to OSCEs to graded formative, graded summative, all those kind of things. So, but I would refer you back to your legal department and your actual policies at your university for that.
And to reinforce, whatever your policy is, make sure your students know that before going into the simulation. So in your preparation and briefing, they need to be aware. They need to know whatever the organization's policy is.
Wonderful. Well, we really appreciate all of your time. And Erica, there. Thank you. I was like, I still can't see the screen. I can see it now. Thank you. If you want to learn more about how Laerdal can support your efforts in competency-based education, please feel free to use that QR code or go to laerdal.com/CBE to look for some resources. Marie, Brian, Curtis, we are so grateful for your time, and definitely everyone should connect with them at SSIH. I'm part of that group as well, and there's so many great resources and conversations happening on that listserv, so look for that. But thank you all, and hopefully we will see everyone at the next webinar.